Introduction. Puffy tumor is a rare clinical entity characterized by subperiosteal abscess associated with osteomyelitis. It's usually seen as a complication of frontal sinusitis of trauma to the frontal region, predominantly in the adolescent age group. Puffy tumor requires rapid medical and surgical intervention to prevent complications that increase morbidity and mortality. Puffy tumor can be associated with serious complications as cortical vein thrombosis, epidural abscess, subdural edema, and brain abscess. Discussion. PPT is very rare complication of frontal sinusitis in the age of antibiotics. It is found mainly in adolescents. According to the World English Language Literature, only 13 to 14 cases of adult patients with PPT were reported between 1990 and 2016. PPT is a risk factor for endocrine complications, which have been found in about 60 to 85% of patients with PPT. Anatomical characteristics of frontal sinus and its specific brains could be the factors influencing the development of PPT and its complications. Pneumatization of the frontal sinus starts at about 1 year old and continues until 18 years of age. Many anatomical factors may narrow the frontal recess until complete obstruction. These include over-pneumatized ethmoid bulla, extensively pneumatized middle turbinate, enlargement of air nasal cells, among others. Sinus obstruction by anatomical anomalies and inflamed mucus leads to ciliary dysfunction and mucus stagnation that results in an anaerobic environment in the sinus. In the case of our patient, an over-pneumatized middle turbinate affected the frontal recess drainage of the left side. Conclusion. In conclusion, Puffy tumor is a sign of a potentially life-threatening infection of the frontal sinus, which may be accompanied by intracranial invasions. Dermatologists should be aware of this pathological condition when patients present with swelling of the upper eye for fronthand and perform MRI or CT promptly on any patients.
Hi guys, in this video, this patient, female 56, developed frontal swelling after 15 days of endoscopic sinus surgery and debridement and orbital decompression of left side. So I planned supraorbital approach to open the frontal sinus and to remove the antetable of frontal sinus and obliterate the frontal sinus so that the dead bone should be removed properly and infiltration will work properly. So this is Pott's Puffy tumor post mucormycosis. Thank you so much.
बोलो वैसा करो।
नहीं, आप बोलेंगे वैसा ही करेंगे ना, हमको क्या समझता है। नहीं, मैं समझी आप बोल रहे थे ना, इसलिए मैं बोली क्या बात।
इधर दबाओ, इधर, उधर। ये आंख बंद करो। हाँ, अभी कितनी उंगली है?
2
अभी
3
अभी
3
ओके। आंख घुमाओ फिर से। आंख खोल दो दोनों, दोनों इधर।
नहीं बोला।
हाँ,
घुमाओ।
इधर
की घुमाओ।
इधर इधर घुमाओ। आंख घुमाओ, आंख।
हाँ करो, बंद हो।
Thank you for attention.